Because some patients, they will have a suicidal ideations for years, months. You understand? And they're not acting on it, and they are working closely with their psych team. So if you're able to identify whether or not this is something that is chronic, ongoing for these patients, then you will be able to see which direction you need to go. I just went in and saw a patient with a history of schizophrenia and bipolar disorder. He's been compliant with this medication, but with our mental health patients, how do I normally see them if I am not a nurse practitioner who specializes in that area? On a monthly basis, I do see them as a part of the follow-up. They are already established with a psychiatry team. So whether or not it's someone that we refer them to or a service that we referred them to, or they were already set up with the state psychiatry team or program where they are also assisted with their medication, then we will go ahead and continue those patients' management. A lot of times, you know, as I said, the state do have programs in place for mental health or psychiatry management of these patients. So we go ahead and just ensure that these patients are compliant with their medications when we check in with them. They're not having any side effects, you know, and in the event that they're having any concerns such as weakness, you know, burning on urination, constipation, they're not eating properly, or sometimes, you know, you meet up with them and they're having some thoughts of suicidal ideations, or they're feeling depressed, anxious, they're having panic attacks because of multiple things, then definitely we will go ahead and ensure that we put plans in place to address that. If they are feeling suicidal at the time of our evaluation, then definitely we will go ahead and call the ambulance, or sometimes depending on the severity or how long they've been having some of their symptoms, then definitely we will go ahead and call the psych team to see if this is something that needs to be addressed in the emergency room, or if it is something that they're able to talk to the patients regarding. Because some patients, they will have a suicidal ideations for years, months. You understand? And they're not acting on it, and they are working closely with their psych team. So if you're able to identify whether or not this is something that is chronic, ongoing for these patients, then you will be able to see which direction you need to go with, you know, your patients in terms of for further management. Do we need to send them to the emergency room right away, or do we need to just call their psychiatry team and hear what their plans are? Are they going to be seeing the patient? Are they going to be sending someone over to do an in-person visit a little bit more frequently? You know, so things like that, we do go ahead and speak with the team so that we can have a better idea of the plan of care to address these patients' concerns. But the most important thing when it comes on to these kind of patients, you definitely want to go ahead and make sure you're documenting, and not only for your psychiatry patient or your psychiatric patient, you definitely want to ensure that for all your patients, whatever contact you do, definitely document it. If it's a case where you're trying to coordinate care and you're speaking with this person, document it, so that way when it comes on to you pulling up the record to find out what was done or who had said what, it is already well documented in your notes. So always go ahead and make sure you document. And if you know me by now, you'll hear me talk about documentation all the time. But I tell you, when it comes on to your psych population, make sure you're documenting very, very good on these patients, because you don't know, you know, you don't want it to be a case where the patient had said something and you missed it, or the patient had said something and you don't address the concern, and then something do happen where it becomes your problem. Alright, so basically that's about it when it comes on to the psych patients. So if it's the first time I'm seeing the patient and they haven't been started on any medications, I will go ahead and start them on some medication, and then at least that medication will hold them for probably like 30 days, and eventually they will get set up with their psychiatry team for management. So that's about it when it comes on to the psych team. Alright, I'm gonna go and see this group home, and then I will be back shortly. We will continue with other topics regarding house call service and what I do on a daily basis. All right, until then, I will see you in the next video. Bye.